you don't necessarily need to have a hysterectomy. These days, there's been great advances in care of problems with regards to control of periods, so that the hysterectomy is done a whole lot less often than it ever used to be. So we've got options such as the Mirena and endometrial ablation, which are really good options that have dramatically reduced the rate at which we need to do hysterectomies. But there are still indications for hysterectomy, and I think the question is not whether you should have a hysterectomy, and often that comes down to personal individual choice again, but how it should be done. And there's a very strong tendency these days to all be done laparoscopically. Once upon a time it used to be common for it to be done abdominally, which involves cutting the abdomen and getting an abdominal wound, which leads to slow recovery and pain and so on. I've always been keen to do it vaginally. Along the way, laparoscopic hysterectomy has come along, and laparoscopic hysterectomy is the way it's most commonly performed these days, but that's mostly a reflection of the skill set of the surgeons that are involved, not necessarily a reflection of what's in the best interest of the patient. And I think what's in the best interest of the patient is really the thing that counts. And if I can possibly do a hysterectomy vaginally, I will always do it vaginally. Vaginal hysterectomy is basically harder work for the surgeon, but I don't mind doing harder work for my patients because that's what it's all about. And the advantage for the patient, for me choosing to do the harder work, is that we get quicker recovery, and more importantly, we get a safer operation, because doing it vaginally is actually safer than any other way. So you get minimum pain, quick recovery, and the safest operation that we can do, for the sake of the surgeon having to work reasonably hard to do it. Not always, sometimes it's very easy, but some of the traditional contraindications to vaginal hysterectomy are not real. For example, caesarean section was always considered a contraindication. I've done many vaginal hysterectomies after previous caesarean section. I've done vaginal hysterectomies for very large uteruses, which has always also been considered a contraindication. I've also done them for uteruses where there doesn't seem to be a whole lot of descent of the uterus, and that just makes it a bit harder, but it's still very achievable. So if it's going to be done, I think it's in the best interest of the patient if it can possibly be done vaginally.